If you're in nursing school, you know that feeling, right? You're staring at an exam question and it feels like it's written in a completely different language. Well, today we are going to crack that code. We're going to get inside the logic of the ATI Fundamentals exam so you can start thinking like the people who write the tests. And just so you know, everything we're about to cover comes straight from the ATI Fundamentals Proctored Exam test bank. So yeah, for all you nursing students listening, this is the real deal. This is designed to get you ready for what you're actually going to face.
So let's just get right to it. What are these exams really testing? Is it just about cramming thousands of facts into your brain? Well, not exactly. They're built to see if you can think critically, if you can prioritize under pressure, and, most importantly, if you can keep your patient safe. They're testing your nursing judgment.
So here's how we're going to tackle this. We've broken it all down into 4 key pillars. We'll start with the number 1 absolute non-negotiable: safety and prioritization. Then we'll get into the nitty-gritty of procedures and best practices. After that, we'll explore the art of care and communication. And finally, we'll pull it all together with what we're calling the nurse's mindset. All right, first up, pillar 1, and if you only remember one thing from this whole explainer, make it this: safety comes first, always. The questions in this category are designed to see if you can spot the biggest, most immediate risk and deal with it right now. So let's look at a classic scenario. You see a patient, they're clearly confused, unsteady on their feet, bumping into walls. Now, you have a few options. You could try to reorient them, maybe get them a snack, think about medication, but what is your absolute number 1 first priority? And the answer is, you physically guide them back to their room. This is the safety and risk reduction framework in a nutshell. It means you always deal with the immediate physical danger first. Before you assess, before you talk, before you do anything else, you prevent the fall. That physical safety is everything. Okay, let's try another one that's all about making that tough call. Your patient lists 4 different things that are stressing them out. And you know what? They're all valid worries. But you're the nurse. You have to pick one to deal with right now. Which one is it? The answer has to be B, the pain that's keeping them from sleeping. This is a perfect example of Maslow's hierarchy of needs. Remember that? The most basic, fundamental, physical needs have to be met first. You just can't effectively help someone with their job or family worries if their body is in pain and they can't even get restorative sleep. You fix the physiological problem first. Now, let's move on to pillar 2. This is where we get into the how of nursing, but more importantly, the why. It's not just about memorizing a checklist of steps for a procedure, it's about deeply understanding the principles that make those steps the right ones to take. Okay, here's a procedural question for you. You're giving an enema. You know there are a few steps you have to follow, but one of them is absolutely critical, and it's based on straight-up human anatomy. Do you know which one it is and why it's so important? And there's the why right there. You position the client on their left side. Why? Because you're literally using gravity. The anatomy of the colon, the sigmoid and descending parts, means that position helps the solution flow exactly where it needs to go. See? When you know the anatomy, the procedure just makes sense.
Thanks for watching. Enjoying the content? Like, share, and subscribe for more. Now back to the video.
Okay, let's raise the stakes. We're talking about tracheostomy suctioning. This can be a life-saving intervention, but it's also risky if you do it wrong. So, what is the single most important thing you do before you even begin the suctioning process? The answer is you hyperoxygenate the client. Think about it. You are about to suck air out of their airway, so it only makes sense to give them a boost of extra oxygen first to prevent their levels from dropping dangerously low. And this slide also shows the big no-no. You never apply suction on the way in. That's a surefire way to damage delicate tissue. All right, time to switch gears and put on our math hats for a second. This is a core nursing skill, calculating a drip rate. You've got to infuse 40 milliliters over 20 minutes, and the tubing has a drop factor of 15. The formula is right there on the screen for you. Go ahead, take a crack at it. And the answer is 30 drops per minute. Simple as that. You take the volume, 40, divided by the time in minutes, 20, which gives you 2. Then you multiply that by the drop factor, which is 15. And 2 times 15 is 30. Getting this number right isn't just about passing a test. It's a fundamental part of patient safety. Now for pillar 3. You know, being a phenomenal nurse isn't just about what you can do with your hands. It's about how you connect with your head and your heart. Therapeutic communication, ethics, these are tested just as seriously as any clinical skill. So imagine this. A patient is telling you about their pain, but they're being a little vague. How do you make sure you get exactly what they mean without, putting words in their mouth? There's a specific communication tool for this.
This is where you use a technique called clarifying. You simply reflect back what you think you heard them say. When you say, "So it sounds like your pain comes and goes," you're not telling them what they feel. You're asking for confirmation. It's so simple, but it shows you're listening and makes sure you're both on the same page. Okay, here's a question that gets into ethics. You tell a patient, "I'll be right back." But then you get pulled into a code blue down the hall. As soon as it's over, you make a point to go right back to that first patient. What core value of nursing are you demonstrating?
This action is a perfect example of fidelity. It's a fancy word, but it really just boils down to keeping your promises, being faithful to your word. You have no idea how much trust is built in those small moments, just by doing what you said you were going to do.
And that brings us to our final pillar, the nurse's mindset. This is really where everything we've talked about comes together. It's about thinking ahead, seeing the entire picture, and always keeping the patient's long-term health and well-being at the center of it all.
And this leads to such a critical concept, being proactive. The classic example you'll see on exams is about discharge planning. When does it begin? The correct answer is always on admission. The moment that patient walks in the door, a good nurse is already thinking, what will this person need to be safe and successful when they go home?
So let's just recap the code we've been cracking today. It really all boils down to these 4 things. 1, safety is the unshakable foundation. 2, you have to know the why behind every single thing you do. 3, your communication has to be clear, therapeutic, and intentional. And 4, at the end of the day, everything you do is about empowering your patient. And so that really leaves us with one final thought. These pillars, they're not just tricks to pass a test. They are the absolute bedrock of what makes a nurse truly excellent. So the real question for you isn't just if you can use these ideas to get the right answer, but how you're going to use them to build your entire nursing career and become the kind of nurse your patients deserve.
Enjoyed this video? Please like and subscribe. It helps the channel grow, allowing more content for you. New videos weekly. Thanks for watching.